Good morning, everyone. Myself, Siranjeevi. I am pursuing MPT Sports and Manual Therapy in Saveetha College of Physiotherapy. My co-author is Dr. Vinod Kumar Ramalingam, Professor in Saveetha College of Physiotherapy. My topic is about comparative effectiveness of ballistic stretching versus static stretching along cryotherapy in managing delayed onset muscle soreness among football players. In introduction, uh, delayed onset muscle soreness is a kind of muscular damage which is caused by unusual exercise or eccentric exercise, which is resulting in symptoms of DOMS. These microtraumas triggers an inflammatory response, leads to an increase of immune cells, fluid accumulation, and pain perception. Clinical indications includes decreased force capability, more excavate mobility restriction, stiffness, edema, and joint dysfunctions in nearby area. Ballistic stretching and sport-specific dynamic activities should be performed to minimize impairments and improve performance. Cryotherapy, the application of cold temperature to the body, is widely used as intervention for managing pain and inflammation. Cryoball therapy involves using an handhold technique, which a cold device to target a specific area to treat the pain and inflammatory regions. Review of literature in 2018, Hotfield et al. His study explains about the patho- pathogenesis and diagnostic approaches related to delayed onset muscle soreness. It highlights the role of muscle trauma, inflammation, and neural adaptations in the development of DOMS. In 2003, Chong et al. The author reviewed that treating strategies of delayed onset muscle soreness and analyzed various performance related factors. They found that although several methods like massage, cryotherapy, and active recovery are used, their effectiveness of varies significantly. In 2011, Bhim and et al. In their study reviews focusing on the acute effect of dynamic and static stretching on the athletic performance. It concluded that static stretching before exercise could negatively affect the strength and the power, while dynamic stretching enhanced the muscle performance. In 2017, Maini et al. These meta-analyses assess that effectiveness of cryotherapy in post-exercise recovery. In research suggests that the cryotherapy can reduce the perceived muscle soreness, but by offering the limited impact on functional recovery measurements. Background of this study: delayed onset muscle soreness, which is characterized by muscle soreness, stiffness, and a reduced range of motion, can seriously impair performance and reputations. Athletes often experience delayed onset muscle soreness after engaging in strenuous or intensive activities. There are now several scientific studies validity indicates for treating both acute and chronic pains, like ballistic stretchings has been shown in numerous studies in increasing range of motion and muscle strength and jumping activities and sprinting time. Additionally, in some studies indicates that cryotherapy is commonly used by strategy for pain and inflammation management. My study is aimed to compare the efficiency of traditional stretchings like static stretching and uh, my stretching like ballistic stretching with cryoball therapy in the athletes with induced DOMS. Need for the study to the purpose of the study is to evaluate the effectiveness of ballistic stretching with cryoball therapy and conventional therapy among the athletes with induced DOMS. Cryotherapy, the application of cold temperature to the body, is widely used for intervention to manage pain and inflammation. Cryotherapy, like cryoball, involves as in handhold technique. Cold therapy device to target the specific muscle area. Aim and objects. Aim is to find out the effectiveness of ballistic stretching with cryoball therapy on DOMS in football players to improve the flexibility and reduce the risk of injury. Objectives: To compare the effectiveness of ballistic stretching with cryoball therapy on DOMS in football players using FMS, functional movement screening. To determine the effectiveness of ballistic stretching with cryoball therapy on DOMS in football players using VAS AI, like visual analog scale. Methodology. This study is an experimental study designed to compare the effectiveness of ballistic stretching combined with cryotherapy, whereas static stretching with the cryotherapy on delayed onset muscle soreness management in the football players. Random sampling could be employed to select the participant to who meet the inclusion criteria. Inclusion criteria such as age group of 20 to 30 years old male athletes as a football players with the active presence of DOMS, who are reduced muscle flexibility and a minimal level of physical fitness, and exclusion criteria such as recent musculoskeletal injuries, fractures, history of recent surgeries, chronic pain or any musculoskeletal syndromes, peripheral neuropathies or several neurological disorders, use of any pain medication or anti-inflammatory drugs, allergies to uh, sensitivity to the cold. Intervention. The study could be include 30 participants equally divided by two groups. Will explain to the each participant and a written informed consent will be obtained after induced DOMS. My experimental study receives 10 minutes of ballistic stretching followed by 5 minutes of cryotherapy by using cryoball therapy. Control group receive 10 minutes of static stretching followed by 5 minutes of cryotherapy. This also in cryoball therapy. Both groups will be participants in their respective interventions for 3 days per sessions over a period of 4 weeks. And 30 minutes of sprint test or to analyze the muscle performance and maximum speed of the each point. In the studies, two cells are used to record the time of the each run. Intervention, 3 sessions per week, duration 4 weeks. So front squats and Bulgarian squats, front lunges, plyometrics like jumping walk, drop jump, 30 minutes sprinting will be performed for 10 repetitions and 3 sets at a 60% of their 1 hour. Outcome measures, pre-test and post-test assess will be conducted to measure changes in pain, flexibility, and functionality. For pain check AI is used to assess the pain level with use of visual analog scale. Pain check AI is assessed by the facial expressions uh, like pain expressions, which is calculated by pain check AI. And functional movement screening is a common measurement scale to evaluate overall functional movement and performance. Sit and reach test to measure the flexibility of hamstring. These are the post test values of pain check AI and FMS and sit and reach test graphs. Uh, the blue graphs are indicating the experimental group. The red color graphs are indicating that control group. In the VAS, less amount of pain showed in the VAS scale and increased functional movements showing in the experimental group and increased flexibility showing in the experimental group in the sit and reach test. Uh, Discussion. This study examines that effectiveness of ballistic stretching and cryoball therapy in evaluating delayed onset muscle soreness in football players. Ballistic stretching characterized by rapid and repetitive bouncing movement has shown that the potential to improve the flexibility and promote circulation to the affected muscles. In this, increased blood flow may fluid the removal of metabolic waste products such as lactate and enhance the delivery of oxygen and nutrition necessary for the muscle recovery. However, the dynamic nature of ballistic could be lead to microtraumas. It already fatigue muscle, potentially prolonging recovery in the certain cases. On the other hand, we have cryotherapy. Cryotherapy, which is involving in the application of cold therapy to the body, it's widely knowledge about its ability to reduce the pain and numbness and slow down the nerve conduction velocity. These effects of particularly beneficial in managing DOMS, or as a cryotherapy is magnetic to include that triggered by eccentric muscle activities. Additionally, cold exposures may be constrict the blood vessels. It's called constriction followed by vasodilation, reducing in swelling and pain over the muscles. Conclusion: the present study conclude that ballistic stretching with cryoball therapy and static stretching with cryoball therapy significantly improve over the 4 weeks period. However, the ballistic stretching is with the cryoball therapy shows greater improvement compared to the static stretching with cryoball therapy. These are my reference articles. Thank you.